Never touch a patient's skin directly. Be sure that all applications are covered with some type of cloth. Observe the skin for signals of complications. Immediately report to the nurse any pain, numbness, or burning sensation, any excessive redness, or a blistering that you might see on the skin. There are safe ranges for the application of warmth. A warm application is between 90 and 100 degrees Fahrenheit. Hot is between 100 and 105 degrees Fahrenheit, and very hot would be 105 to 115. Above this can cause burning, and so you would not use any temperature above 115 degrees Fahrenheit. There are several methods for applying warm, dry applications. One is the use of an Aqua K pad. This consists of a plastic pad with fluid-filled coils and a control unit that maintains a constant temperature of the fluid in it. Electric pads are also used in facilities. However, if a patient brings one in from home or a family member brings in from home, that should be reported to the nurse, because most instances they are not permitted to be brought in. They must be purchased by the facility and used there. And the reason for that is sometimes patients may bring in electric blankets or heating pads that have frayed electrical cords and could cause fire hazard. Another kind of warm application would be a gel pack. The risk of burning is less than with moist heat because the dry heat does not penetrate as deeply, and also because water which conducts heat is not involved with a dry, warm application. Remember, moisture does intensify heat, and you must use extra care. For each of the warm treatments, follow your facility's policy very carefully for the length of time the treatment is to be applied, how often the patient needs to be checked for the condition of their skin, and any signs that the treatment should be discontinued. Warm, moist application could be a warm soak. This is where the patient's whole body or just a part of the patient's body that's being treated is immersed in a tub that's been filled with water at a specific temperature, usually about 105 degrees. A foot soak might be a type of warm soak that's used for maybe an ingrown toenail, or something called a sitz bath may be used where an individual sits in their bottom, actually, their rectal area sits in a warm basin of water, and that's used for rectal surgery patients, or it might be following the delivery of a baby. It provides a relief of pain and soothing warmth to the area. Another application might be a wet compress. That consists of a washcloth or a small towel or gauze dressing that's soaked with water. There are sterile and non-sterile compresses. Sterile applications are used when there has been open wound, and because it's an open situation, is performed only by the nurse. Now I'd like you to watch a demonstration of applying a moist, warm compress. Wash your hands and assemble your equipment. Identify the patient and explain the procedure. Provide for privacy. Expose only the area to be treated. Note the condition of the skin. Place a bed protector under the body part. Fill the basin 1/2 to 2/3 full with hot water. The water temperature should be 105 to 115 degrees. Use a bath thermometer to verify. Place the compress in the water. Wring it out. Apply the compress to the affected area. Cover the compress quickly with a bath towel followed by a plastic wrap, or use an aqua-K pad. Note the time. Place the call light within easy reach of the patient. Check the area every 5 minutes. Note any redness, complaint of pain, numbness, burning sensation, or other discomfort. Remove the compress immediately if any occur and report to the nurse. Remove the compress after 20 minutes, or as directed by the nurse. Pat the area dry with a towel and assist the patient to a comfortable position. Return the equipment to its appropriate area and wash your hands.